Good morning, everybody. In the last 24 hours, 136,000 people came forward and got vaccinated in New South Wales. This is a new record, and can I thank every single person for leading the charge in getting those vaccination rates up. We also had more than 150,000 people come forward to get tested, and we're now at 6.2 million jabs in New South Wales. Last night to 8 p.m. there were 1,029 cases of community transmission, and 3 people lost their lives, and we extend our condolences and sympathies to their families. Unfortunately, all 3 were unvaccinated, a male in his 30s, a male in his 60s and a male in his 80s, and again we extend our deepest condolences. As you know, every day we talk about the suburbs in southwestern and western Sydney that are areas of concern. Now they comprise over 80% of all the cases in those areas, so the concentration of cases in those areas remains the case, and we just ask everybody in those communities just to adhere to the advice. Please know that every time you leave your home, you should assume you have the virus or somebody you're coming into contact with has the virus. As far as Western New South Wales is concerned, we have seen obviously the concern level there continue in relation to the number of cases, and that is the most area of concern in regional New South Wales. However, there has been a stabilisation of cases pretty much across the regions, but for Western New South Wales, and Dr. Chant and the Deputy Premier will speak about that, and we're obviously making sure that we support those communities through social services, government agencies and vaccination. Given that acute situation in Western New South Wales and Dubbo in particular, the regional lockdown will be extended to all of regional New South Wales until at least at least midnight Friday the 10th of September. Now, we do appreciate there are many communities in the regions that don't have any cases, that have never had any cases, and they're really wanting to come out of lockdown. But as a precaution, the health advice says that we should extend the lockdown to all of regional New South Wales until midnight Friday the 10th of September. As you know, we've been speaking about what milestones we can support the community with after 6 million jabs. Tomorrow, the New South Wales Government will speak about our schools plan and how there'll be a safe return to schools. But today, I'm pleased to announce that given we did get to the 6 million jabs, that from the 13th of September, so in a couple of weeks, in the local government areas of concern, families, a household, will now be able to go out for an hour of recreation on top of the hour of exercise. So a family will be able to sit in a park so long as the adults are vaccinated, and that is key. So long as the adults in that family within the household are all vaccinated and can demonstrate their proof of their vaccination, they will be able to have an hour of recreation on top of the hour of exercise. So that could be sitting in a park with a picnic with their household or similar event. In relation to areas outside the local government areas of concern, so for the rest of Greater Sydney and for the regions, 5 people will now be able to gather outdoors so long as all adults are vaccinated. That 5 can include children, but obviously if it's 5 adults, all of the adults, and for adults for this purpose is over 18 years of age, all of them will need to be vaccinated. So it means that if you have friends or relatives within your LGA or within the 5 kilometres, you will be able to congregate together in an outdoor gathering of 5 as opposed to just 2 from different households. And we know, and Dr. Wright, who's a chief psychiatrist, is here, we know that people coming together is what people miss the most. And whilst there are various options we looked at, that was the option that met the mental health needs and wellbeing of our community, but also provided the lowest risk setting. So the news is that if you live outside those areas of concern, so long as the adults are fully vaccinated, 5 people can gather for an outdoor gathering. But whether you're in the local government area of concern or outside those areas, you have to stick with the existing rules. So the 5K radius, or else within the LGA and the 5Ks. All other rules still apply. I also want to strongly message today that New South Wales is calling on industry and citizens to get ready for when we are 70% double vaccinated. That's when things will start to open. The New South Wales Government will start conversations with industry, but we do say that the condition of you participating in what will be reopening is on you being vaccinated. because when you start opening at 70%, there are certain activities only vaccinated people can do. Because we know that whilst a certain proportion of the population is unvaccinated, that poses a risk to too many people. So for that reason, we're asking industry to dust off their COVID safety plans, get the QR codes in check, and we're also working on an app in New South Wales that will allow you to sign into a venue, but also have proof of your vax all in one to make it as simple as possible, and we'll have more to say about that in coming weeks, I should say. Also know, please, that depending on the case numbers, local government areas could come out or go into areas of concern. So know that that is a lever which obviously the health experts are watching very closely. But if there's a local government area which has shown a substantial decline in cases and stabilisation, that could come out of an area of concern. But similarly, if we see a local government area where health is concerned, that will be added to the list, and know that that flexibility exists leading up to the next few weeks. The New South Wales government, in relation to the 70% double vaccination rate, is working on that roadmap to make it public in a couple of weeks once we've done the work. But again, our key message is you must be vaccinated to participate in what can occur from that time. And if we continue to sprint towards vaccination, we expect that 70% double dose figure to arrive sometime in October. It could be as early as the first couple of weeks of October, depending on how quickly we get ourselves vaccinated. We're doing better than expected. Earlier, the deadline or our time frame for when we'd get to 70% double dose was the end of October, but given the rates of vaccination we're seeing amongst our population, that could be as early as mid-October. So that is an important milestone for all of us to look forward to, and I'm urging everybody to come forward and get vaccinated, not only because you will get freedom, but obviously we want to see those case numbers go down and we want to see the virus come under control, and for those reasons it's really, really important to get vaccinated. I'm also pleased to welcome here Dr. Skinner from Emergency Department of Hornsby Hospital, and Dr. Skinner is going to talk to us about the pressure on the system at the moment, and I want to turn our attention to the nurses and the doctors and all the health clinicians who are supporting our patients with COVID in our hospital system. None of us can imagine what it would be like day in and day out, putting our own health and safety at risk to support the health and safety of others. And I just want to thank every single frontline health worker for the work they're doing, and of course our paramedics and ambulance workers and everybody else in our hospital system that is working so hard and so courageously and bravely during what will be or is the most difficult time in their careers and what is the most difficult time for all of us in our lives. And I just want to extend our deepest gratitude to them. And whilst the system is under pressure, and whilst obviously the system is kicking in the procedures that we have in place for planning for these additional cases, the system has capacity. And I want to make that clear. We don't underscore for a second the pressure the system's under, especially the hospitals within those areas of concern where hundreds and hundreds of cases are currently active. But know that early on in the pandemic, some 18 months ago, we increased our capacity for ventilators and ICU from 500 to 2,000. Now, we're not intending to use all of those at the one time by any stretch. And we know the system is under pressure, but please know that we've quadrupled our capacity. So everybody who needs help will get that help. It might be differently to what you've got help before because of the situation, but please know that the system is kicking in, it's under pressure, but it's able to cope with everybody who needs that attention. And Dr. Skinner will speak to that. So we are at a critical time in dealing with this pandemic, as we have been for some time. But what we do know is vaccines work. Vaccines are critical to us managing the case numbers, but also providing those freedoms. And I look forward to updating the community in coming days. Dr. Chant will now give her update. Then the Deputy Premier will talk about regional New South Wales. Dr. Skinner, the ED specialist, will talk to us about what it's like to work in an emergency department during a pandemic. And then Dr. Wright, our Chief Psychiatrist, will speak about the advice he provided us and obviously where the government landed with what we're allowing people to do from the 13th of September. Thank you.
New South Wales reported 1,029 locally acquired cases of COVID in the 24 hours to 8 p.m. last night, and there were 5 overseas cases. We have 698 people admitted to hospital and 116 people in intensive care. 43 who require ventilation. The age range is from their 20s through to their 70s. So again, COVID can impact in a very serious way on all age groups, and there is no room for complacency. The vast majority of people, 102 of the 116 people in ICU, are not vaccinated. So again, please do not delay. Access vaccines now. Vaccines are available through pharmacies, GPs, through the booking system, so go online. Please get vaccinated. Tragically, we have had to report today 3 more deaths. Each of these patients was being cared for by Western Sydney Local Health District. There was a gentleman in his 30s from Western Sydney who died at home, a man in his 60s from Western Sydney who died at home, and a man in his 80s. These deaths occurred on different dates from the 17th of August through to the 21st of August. Can I just extend my sincere sympathies to their families, and these cases are also being investigated by Western Sydney to look at any learnings accrued as they all deteriorate at home. And just in general, I think this has been highlighted by our previous speakers this week, that with COVID you can deteriorate. So if you've got any change in your breathing, difficulty breathing, dizziness, or your condition is deteriorating, do not hesitate. Although our system is clearly under stress, the best thing you can do is present early for care, because by presenting early, it gives the clinicians the best chance of not having you progress. So please do not hesitate. If any deterioration, please get tested. The suburbs of concern are Marylands, Guildford, Auburn, Granville, Greenacre, Blacktown and surrounding suburbs. I want to do a particular call out to residents of Tamworth, Merimbula, Cooma and Brewarrina, as the sewerage is positive, and at this stage we don't have known cases. So we are very concerned, and we need to have those high testing rates to give us that assurance. Thank you very much.
Well, good morning. Can I start by offering my condolences to those families that lost loved ones overnight? You remain in our thoughts and prayers. I'll start with the decision by the Crisis Cabinet to continue the restrictions and the stay-home orders, the lockdown for regional rural New South Wales. We are on a knife edge in the regions. We need to take pressure off the health system. We've got areas of concern like Western New South Wales, the far west. We still have cases in the Illawarra and the Hunter New England area, the Central Coast. But at the same time, as Dr. Chant's touched on, sewage surveillance is showing fragments in parts of regional rural New South Wales where we have no known cases. So the decision to extend the lockdown is one to protect communities and protect the regions. We're sitting on a knife edge. It's a tinderbox ready to explode, and I do apologise to those communities that don't have cases today, but I put it this way. The reason you may not have cases is because of the restrictions in place, minimising movement, because we know we're a very interconnected community in regional rural New South Wales. But we'll be working with those communities, we'll be working with the health team to identify opportunities going forward. But now is the time to stay united and work to those restrictions. In regional rural New South Wales, till 8 p.m. last night, we've had significant cases again in Western New South Wales Local Health District. 35 cases in all. Bathurst had 2 cases, 2 in Burke, 25 in Dubbo, 1 in Forbes, 1 in Mudgee, 3 in Orange, and a case in Parks. And the case in Parks concern us because we can't identify the source, so that does give us a level of concern. In the far west, there were 6 cases overnight. 5 were in Wilcannia and 1 in Broken Hill. The Hunter New England, I can report there were no cases overnight, which is a good sign. We've done a good job there. People have followed the rules, but as we know, those numbers can fluctuate on a daily basis. In the Illawarra Shoalhaven region, we have 2 new cases overnight, and they are in the Wollongong local government area. On the Central Coast, again, 2 cases. I just want to touch on again the sewage surveillance in Tamworth, Merimbula, Cooma and Brewarrina. They are alarming. Again, as always, it's been a significant tool that we've used in the past in relation to identify cases. Rarely do we get it wrong. Surveillance works, and again, we call out to those communities to remain vigilant. Any signs or symptoms, please get tested and come forward to get tested. The message again, make sure we continue the vaccination race in regional and rural New South Wales. It's great to see the numbers today. I do want to call out Broken Hill, who have gone has a 56.6% single dose rate and a 36% double dose. Cootamundra-Gundagai 66.9% single dose and a 37.8% double dose. And Orange a 61.4% single dose and a 35% double dose. And a worthy mention for the community of Narrandera, in just under a week, they went from a 36.7% single dose to a 61.7 single dose. So again, the message to regional rural New South Wales, keep getting vaccinated. It is the ultimate protection against the virus and minimising spread. Thank you.
Hello, I'm a bit different. I'm Dr. Clare Skinner. I'm a specialist emergency doctor working in the New South Wales public hospital system. First of all, I'd like to express my condolences to people who've lost lives due to COVID or those who have family members, and also to acknowledge the enormous suffering and hardship that people are experiencing under pandemic conditions at the moment. There's no doubt that this is the biggest challenge that healthcare workers have faced in their careers. Things are tricky, we're stretched, but we're working as hard as we can to keep the system as safe as possible for patients and communities and for healthcare staff. Something that's really important at the moment is that you do seek care if you need it. We're really concerned that people are avoiding seeking urgent medical care. And while the system's under pressure, we're doing everything we can to make sure the care is there for you when you need it. So if you have an emergency, please come to the emergency department. We've got a pandemic plan. We've streamed the department to keep you safe. We've got full infection control protocols in place, and we're all wearing personal protective equipment. If you have another matter, please see your GP. Again, there are measures in place to seek urgent care, so please don't delay. I think everyone said thank you to the healthcare workers, but this is not about healthcare workers. This is about all of us, and what healthcare workers would like is for the community to pull together with us, because we really need your help flattening the pandemic curve. So please follow the spatial distancing rules. We know they're tough, but you're doing a great job. Please get vaccinated. Please wear a mask. And please, if you have any symptoms at all, can you seek testing and care as soon as possible, because we need to know that you have COVID quickly. Delta is a bit of a game changer. We need you to take it seriously. It's not a cold, so please, any symptoms, get a test, because that's how you help healthcare workers and how you help the community and how you help your family. And again, please get vaccinated as quickly as possible. From healthcare workers, that's the thing that's going to get us through. So we need your help to flatten the curve and get vaccinated. Thank you very much for everything you're doing, and we know it's really hard.
Good morning. My name is Dr. Murray Wright. I'm the New South Wales Chief Psychiatrist. This morning I wanted to say a few words about the concept of recovery as we use it in the mental health world. It's a really important word and a very important concept, and I think it has great relevance as we consider, both from a personal and a community perspective, what confronts us on the way forward in relation to the pandemic. When I first began working in the mental health area many decades ago, people who were suffering from serious mental illness often developed a sense of pessimism and hopelessness about their condition. It was seen as a chronic and recurring condition from which a person could recover, or they could suffer serious consequences and recurrences during their life. Out of this sense of pessimism and at times hopelessness grew the recovery movement during the 1980s and the 1990s. And the recovery movement demands to put the individual back in control of their destiny. And it's about self-determination, and it's about the individual, notwithstanding the constraints and the risks and the challenges of experiencing a mental illness, taking control of their life and determining what matters for them. And a lot of it has to do with engagement, re-engagement into the community, developing social cohesion and developing meaningful activities with their lives. It's highly relevant at this time. The key considerations in this area include the understanding and the management of the risks, and so it's not ignoring the risks, and it's also not being defeated by those risks at the same time. Our understanding of recovery at a community level has been enhanced by our experiences as a result of natural disasters over the last few decades. And again, the key principles in terms of recovery as a community are about trying to enhance the redevelopment of social cohesion and connectedness, and also self-determination within that community that's experienced a natural disaster. Restrictions are a necessity as part of the response to the pandemic. But all restrictions and any modifications to those restrictions, either tightening them up or easing them off, all those decisions are made balanced against both the benefits and the risks. And sometimes those risks are about the risks to community and individual mental well-being. And we have an active voice in considering the risks and benefits every step of the way. We know that people recovering from sustained stress and depression often, as a result of those experiences, have disengaged from their family, their loved ones, their social activities, and they often feel quite defeated and pessimistic about the benefits of re-engagement. Sometimes their motivation and self-belief has been eroded as a result of those experiences. And in any kind of treatment situation, it's really important to help that person or those individuals identify what are the key things that matter to them in terms of their connections with others, whether it's the workplace, the community, or their recreational activities, and to try and figure out ways to reconnect. In my opinion, that's very appropriate for us now and going forward. Spare a thought for those people in your circle who may have experienced particular challenges during the course of the pandemic. People who live alone, people who have experienced loss, whether that's loss of their livelihood, their family, or a loved one. Individuals who are still disconnected from their families because they're interstate or overseas. And also people who have been dealing with mental health issues, either pre-existing the pandemic or as a result of their experiences during the pandemic. And don't forget young people, because these individuals are beginning to make their way in the world, and that's hard enough at the best of times, but much harder when you're faced with all these sorts of constraints. It's really important to reach out to people and ask them how they're coping with these challenges, but don't forget we have a number of resources that are available to individuals through their local general practice, through counselling services, through online resources, and also telephone-based services such as Lifeline. And just a reminder that the Lifeline number is 131114. Thank you very much.
Mid-September, when outdoor gathering rule is allowed, I think that's when you said that you're expecting the benefit of the vaccination pushing to kick in. Have you given advice to government about where you think case numbers might be at that point, and what is that advice?
So my advice to government is that the case numbers may well continue to go up before we see the trajectory of downward transmission. As I said, that the factors that go into that model is how we're adhering to the mobility restrictions, how we're individually behaving. We have seen some deterioration in some of those metrics because people are obviously feeling so tired and frustrated with the length and duration of the restrictions. So I can't, in answering your question, the model is the model, but the inputs into the model also reflect how we as individuals behave. They also factor in how quickly we're vaccinated and whether the vaccine is getting into the places we need it. So it is critical that the people of southwestern Sydney and Western Sydney are afforded every opportunity to take up the vaccines as quickly as possible. And that has been the focus of our vaccination efforts, to provide that access in conjunction with the great work of general practice and pharmacies, who have also stood up to try and increase those rates. But we also need everyone to do the right thing. As you know, we see the predominance of cases in southwestern Sydney and Western Sydney, but you cannot be complacent anywhere. And we do see the fact that people bring it back to different communities. And if people are not following the rules there, we can have additional bushfires. And at the moment, with our stretched system, we do not want to be fighting bushfires on multiple fronts. And that's why I'm so pleased as well that we've got the regional lockdown in place for 2 more weeks, so that we reduce that risk of any bushfires in the regions.
Dr. Chant, just to follow up on that, though, has there been a ballpark figure put together about where you think cases might be?
So the modelling is redone every time, and clearly we've got at 1,000, and I would indicate to you that the numbers may well go way above 1,000 cases.
Dr. Chant, does that mean that this 2 weeks until this starts, that September 13 date is based on the fact that you believe the modelling shows that the numbers will have started their downward trajectory by that stage, and what is that figure expected to be?
So I think it's about 2 things. One is the fact that we want to recognise the mental health impacts on the community. By then, in September, the weather will be a nice time, and we know that outdoor spaces are less risk. What we're doing is also incentivising vaccination, because to avail yourself of this, you have to be vaccinated. And again, in the local areas of concern, we've taken the precaution that it is just open to the household group. And again, it's a thank you to the community. And I think we have to, at this difficult time, say to the community, it can be different, and you have increased your vaccination coverage. And this is about rewarding the community in a way that is very safe. But the numbers are influenced by every action we as individuals take, the actions of the community, the actions of industry. So the model is updated very frequently, but the largest factors in it is how we behave as individuals and how many vaccines we get in. So if we limit our mobility, we don't interact with many people, that will be the best. So what we're trying to do is really get that mobility down as low as possible, particularly in the local government areas of concern.
Based on Dr. Chant, health perspective, what gave you the confidence to be able to tick off on these changes from September 13?
I think that one has to keep them in proportion. We're allowing a household who has been doing it tough in southwestern Sydney and western Sydney to sit in the park as a household if all of the adult members are vaccinated. I think whilst I hope the people of southwestern Sydney and western Sydney appreciate that, for many they will go, that's not much. So I think, to be perfectly frank, these steps are baby steps, recognising the serious situation we are in. And I think it's important that we are allowing those interactions, that human interaction in an outdoor space, fully vaccinated adults across the other local government areas of concern, outside those local government areas of concern. And the other factor that gives a safeguard is that if there is an uptick in cases outside those current local government areas of concern, as the Premier's indicated, they might be in a designated local government area of concern. So that's the other control on this. So very much what setting you are going to have on that date will really be dictated by your actions and movements and your compliance with.
Do you worry, Dr. Chant, the rules could be stretched in some regards, that people might say, yes, we all live in the one household, or?
I think police have, clearly if you live in that, most adults would have some form of identification on you, like a driver's licence. Now with the great digital driver's licence, I think most people have availed themselves of that, or a hard form. I think it's not easy. It's very easy to see that people are within the households, and I think that we have to appreciate the genuine mental health impacts. And this is about an hour of time within a household to sit there and have a picnic. Now, those individuals may not have had the privilege of having a backyard that they can go to. I think we have to balance COVID risk with compassion. Now, obviously, police have been consulted on this, and can I just stress, if there is any issues of non-compliance or it's causing any issues, of course government has always changed its mind. But I think we also, as the Premier has said repeatedly, we have to give the community the benefit of the doubt. The vast majority of people in the community do not want to see their loved ones subject to COVID, come down with COVID, and are doing all they can. And as I indicated, many people are unknowingly becoming infected in various settings.
Deaths. The 3 people, they died at home. Does that have anything to do with the pressure on the hospital system, or were they being cared for in out of hospital at home?
They were being cared for in out of hospital care, but I think any circumstance where there's the deaths, the usual process for health to do is review it and see if there is any learnings. And I think you've seen us over the upcoming days, and again, what Dr. Skinner has indicated. We don't want people delaying getting care, and we don't want people to underestimate that young people are generally not breathless. So young people, breathlessness is a major symptom. So I think people are underestimating. Sometimes they're soldiering on, and I think we need to take every opportunity to get people to present early. Presenting early is key, because we know that good medical care, I defer to Dr. Skinner, but if someone presents early, it gets good oxygen uptake, and that we may prevent them from deteriorating.
I think that's a really good point. So, and hats off to the hard work that my colleagues in emergency departments across New South Wales are doing, but we would far rather see someone early in the course of illness when we have the chance to intervene and to change the course of their illness than to see them when it's really late and they're already requiring ventilation or time in ICU. It's only a small fraction of people who are getting to ICU with this current outbreak. We're actually doing a really, really good job, and I think sometimes we lose sight of that. But that's absolutely dependent on getting tested early and reacting to any, even minor symptoms, and getting a test and seeking care really early so we can turn things around.
There seems to be a problem with people's vaccination record being uploaded from some of our like Homebush, for instance. One person I spoke to this morning, 5.5 weeks waiting for that to turn up on their record. If these people can't, what are the problems with those being uploaded? And if they can't prove it, are they going to get fined?
Look, I'd be happy to look into the particular circumstances. Sometimes it's as simple as someone's Medicare details don't reconcile with the current loading up. I mean, this is a complex system where people upload through the systems, and if there is any mismatch, sometimes it takes a period of time to reconcile those outliers. I can assure you from my own experience and that of my family that the records get generally uploaded very, very promptly. But there will be a small number where just because of data reconciliation issues it takes longer. Can I just say I've been really at all of the press conferences and in discussions with police, they take a very pragmatic view. Clearly they will want that and follow it up, but if you can subsequently demonstrate that, I'm sure that they would show. It's not for me to speak on behalf of police, but at every press conference I think there's been very much a sense that we want to find people for doing the wrong thing. We don't want to find people when it's through no fault of their own they have not been able to demonstrate it.
At the moment, we've indicated that at 80% we might be opening up a bit more widely. Are you concerned at all that the 20%, what if they get sick? Will the New South Wales hospital system be able to cope with that? That's a concern that has been raised by some of the unions.
So I think what we need to say is this is not going to be this is going to be phased and calibrated. The best thing we can do is get vaccinated as soon as possible and follow the public health rules so we can keep the case numbers very low. What we would like to see is, in living with COVID, very, very low levels of community transmission, and what we would like to see is that very high rates of vaccination. Now, I'm going to be greedy. As a public health doctor, I really want to help my ED colleagues, and my dream is to have us be the most vaccinated country in the world. So for me, the sky's the limit, and I actually think that Australians can do it. I think we can actually achieve well over 90% vaccine coverage. What is more critical, and I think this, our experience with Delta has demonstrated this, is that we also need a strong equity focus in our vaccine rollout. We need to make sure that people that perhaps are busier, have to go to work, haven't got time to make a booking, are concerned about access through their GP, can get a vaccine, that there's no barriers for people getting a vaccine. We need to make sure that people that perhaps are homeless, people that maybe have other priorities in their life or other issues impacting on their health and well-being, that we actually support them for vaccination. Because I think you can see that if you have pockets of low vaccination in our community, we'll continue to struggle. And we know how infectious Delta is. It will rip through any under-vaccinated areas. And so I'm so pleased that the focus we've been having and the hard work that districts have been putting in place to actually reach out to homeless, to actually deliver vaccine as well as our mass vaccination. There's been a lot of work with local organisations to identify communities that need extra support, and that's going to be a factor. So it's going to be our overall vaccination level. And let me say, I want us to be the high score for the world, and I think we can do it. And in the remainder, I'm very keen that we are only as good as what we've achieved in our most vulnerable communities. So I want our homelessness level vaccination rates really high. I want our Aboriginal communities to be highly protected by vaccination. I want our drug and alcohol clients, our mental health clients. I want our justice health clients. I want our prisons clients. I want all of those groups very high vaccination rates.
Can I just ask you,
with the outdoor gatherings, does a backyard count for an outdoor gathering? And also, when people are in their outdoor gatherings, do they have to wear masks?
Nobody from outside the household anywhere in the state is allowed into a household. Can I make that very clear? So because of obviously the restrictions that are in place and the fact that we want to get the case numbers down, we want the curve to turn, we can't allow anybody outside a household, no matter whether you have no virus in your community and have never had that. The risk is still there. And so the decisions we came to as a government were very much based on the health advice, but also the advice of the chief psychiatrist. We know people coming together, people enjoying the outdoor weather is a huge relief from a wellbeing perspective, and it's safe. Safer than any other option, and that's why we took those decisions. We think it's a very balanced and measured approach, and this is the approach we'll take when we start opening up. I don't want anyone to be concerned that when we get to 70% double dose, that we're going to do anything which isn't based on sound health advice, but also appreciates our aim to live with COVID in a safe way. And I share Dr. Chant's optimism about our vaccination rates. The way New South Wales has been going is outstanding. And if we continue to sprint, we will make sure we not only hit those 70% double dose targets, but that we get to 80%. Very, very few places on the planet have got to 80% double dose. Very few places have got there. I'm confident New South Wales can get there, and I'm incredibly proud of our citizens who are doing it tough. We've got every reason to be really angry at us, are really going out there and getting the vaccine because they know it saves lives. It helps Dr. Skinner and her colleagues and all the nurses out there who are doing it tough every day. It keeps people out of hospital. And we also know that it helps people look forward to having free life. And every state, and again, New South Wales has had to deal with this in a very stark way. But every state, once we open up at 80% or 70%, every state's going to have to deal with Delta. And every state's going to have to deal with the fact that you're going to have more cases. And as I keep saying, the most important statistics for us to focus on are the high rates of vaccination and the number of people we keep out of hospital. And that is really, really important moving forward.
About 6 million doses. Can I just ask you about 16 to 39-year-olds? You've given priority to 16 to 39-year-olds in the hotspots. What about 16 to 39-year-olds elsewhere in the state? A lot of them still have a bit of reluctance when they're 18 to take AstraZeneca. What should they do And now I've heard they're waiting weeks and weeks for their first dose.
Well, firstly, obviously, the supply constraints exist for people who are between 16 and 18 years of age. But Dr. Chant's health advice, the advice of the public health team, is to gate the highest rates of vaccination we can in those local government areas of concern. In Greater Sydney, those 12 LGAs are comprising nearly 90%, on some days nearly 90% of all cases. And the best advice we have on reducing the case numbers, reducing the rate of hospitalisation, reducing death, is vaccinating people in those areas, especially younger people. We're seeing around 70% of cases are in people 40 years or younger. They're the ones that have to go out for work. They're the ones that have to come home to families and unfortunately are infecting households as a result, sometimes unknowingly because of the way the Delta virus works. So the best health advice is telling us target your vaccinations in the first instance to those local government areas of concern. But obviously we've seen an uplift in many regional communities. Thank you for coming forward and getting vaccinated. There are supplies of vaccine through GPs and we've relied on our GP network. Thanks to all the GPs. We've relied on the pharmacists. Thank you to all the pharmacists and of course our New South Wales Health Hub. So there is vaccine available and we're asking everybody to come forward, follow the health advice and get vaccinated.
Throughout New South Wales, we know that cases are continuing to rise. On regional New South Wales, cases are continuing to rise, and we've spoken to some people concerned about hospitalisations. Wilcannia, places like that, there's barely any health services. Have you considered talking to the federal government about sending out the military to set up things like field hospitals and things to really support them?
I might ask Minister Hazzard to answer that question.
Look, we have actually been working quite closely with the federal government. I wrote to Minister Hunt a couple of weeks ago asking for assistance, and that assistance has come through. They are looking at all options. The focus at the moment has been primarily around vaccinations, but I'm quite sure that if that's necessary, then of course that will be worked through. But what the medical advice has been, I don't think you were here yesterday or the day before, but the medical advice has been that there is capacity in the major hospitals, so for example Dubbo and Orange, and if patients really are in need of additional assistance through the ICUs, then it's still helpful to transfer them into one of the major metropolitan hospitals. So there's a lot of work going on that area, and at this stage I know one of the, I think it was Dr. Ni Nguyen a couple of days ago, who's a intensivist, made the point that those field hospitals were not necessarily the answer for intensive care patients. So at this point, everything's being done that should be done. Yes.
We know there's a lot of pressure on testing. We know there's a lot of pressure on the system with result wait times, and we also understand the tests are going to cost taxpayers a lot of money. We know that symptomatic people should be getting tested, but what about asymptomatic essential workers getting regular precautionary tests? A lot of companies are calling for that. Should that be happening?
Sarah, we've talked about that quite a bit, and Dr. Chant has talked about it. There's every aspect of every part of the health system has a limit, and earlier on, obviously, surveillance testing was a key issue. But I remind everybody that last year, I think about March, April, May, we were really pleased that we managed to get to 20,000 tests. We've been up over 200,000 tests. That puts enormous pressure on the system. So ideally, if we can keep the numbers down to allow, strongly suggesting that people should go and get tested. If they have any symptoms at all, go and get tested, or if you've been in a situation where you've been exposed potentially to COVID, you should go and get tested. But asymptomatic testing can be, in terms of surveillance testing, can be a bar, or it gets in the way of the faster turnaround that our tracers need to have in terms of information. Do you want to add anything to that, Dr. Chant?
I suppose just to highlight that we a few days ago announced just to clarify that we have removed the surveillance testing requirements. And I would urge people that are just getting testing because they want to not do that. They're actually compromising the public health response, including employers who are using PCR testing as a way of giving, wanting that assurance. What we're wanting to do is focus our testing resources on symptomatic people, But clearly we also test asymptomatic people if they're household contacts of cases or in workplace settings where we know transmission has happened. So we do want to see the testing numbers get into a more manageable area. We do want those turnaround times to be back around 24 hours and shorter, as short as possible, in order to really do that test, trace and isolate to slow the curve.
There'd been a lot of anticipation, people waiting for today's announcement to find out what this freedom was once we reached that 6 million doses. There'd been suggestions perhaps hairdressers could reopen, some parts of regional New South Wales could come out of lockdown. Are the increasing case numbers a reason why you didn't go one step further today?
Well, I think what we always need to consider, and we always said we would, is what ticks the box in terms of lowest risk, but highest value in terms of well-being and stress, given what people and families are going through. But I do want to restate this point very, very strongly. We're calling upon industry and citizens to get ready for when we hit that 70% double dose. We are already starting to work with industry stakeholders on how we can go back to safely open up for people who are vaccinated. And this is my strongest message. We are sprinting at the moment with our vaccination rates. Previously, we assumed we'd get to 70% double dose by the end of October. It looks like we could hit that mark as early as the middle of October. So we're saying to everybody, get vaccinated, get fully vaccinated. You still have time to make sure that when we start opening up, you have those options to live a more freer life. Now, we'll be very responsible, as today's announcements have demonstrated. We're a government that assesses the risk, but also assesses our wish to live with this virus and accept that Delta will always be with us for the foreseeable future anyway. That's why we're really saying to our community, we will proceed responsibly to open up once we get to 70% double dose of the adult population. And we ask everybody to come with us on this journey. That will include the local government areas of concern that have those high vaccination rates. Everybody across New South Wales who is fully vaccinated will feel relief once we get to the 70% double dose. And I can't say that strongly enough, because as Dr. Chant and the public health officials say, the higher the vaccination rate, the safer everybody is. But there'll be some things, even when we're at 80% double dose, that people who aren't vaccinated won't be able to participate in. And these aren't necessarily decisions government's making. Organisations will be able to choose whether they welcome people onto their premises, even at 80% who don't have the vaccine. So I just want to give everybody enough notice and enough opportunity to get themselves and their loved ones vaccinated. And as the health officials say, in particular, we want to make sure everybody over 70, there's no reason why anybody over 70 shouldn't be vaccinated unless there's a health reason. But we really want everybody in those vulnerable age groups, people who have those underlying conditions, to make sure they take up the opportunity to make sure that when we do start opening up, because remember, vaccinated people can get the virus, can spread the virus, but obviously at a much reduced rate to people who don't have the vaccine. Clinton up the back has an asked question.
In regards to children, by September 13, it's likely that children above 12...
I'm sorry, Clinton, I can't hear the question. I'm so sorry.
By September 13, it's likely children above 12 will be approved for the vaccine. Does that change this rule in regards to outdoor gatherings? Will kids have to be vaccinated at that age?
Oh, look, at this stage, the rules we've announced today will stay in place, but we will be talking about a safe return to schools tomorrow. And obviously, I'm very pleased with the Prime Minister's announcement about also vaccinating 12 to 15-year-olds. I understand he just made. So please know that we already have put in place our plans for a safe return to schools, and we're looking forward to sharing those plans tomorrow to give parents, school communities certainty. And I just want to thank everybody in the education sector as well for their patience and understanding. And we know for children in particular, as Dr. Wright has said, how important it is for routine to be maintained, but first and foremost, it's public health and safety. We don't want anyone to be concerned about the safety of children, and that's why our return plan for schools, which we'll talk about tomorrow, will consider all the factors we've discussed.
Having 12 to 15 vaccinated, is that going to slow the rollout for adults and affect the girls?
Well, we're expecting the federal government to provide us with extra vaccines in September and October. So obviously that will be factored into our vaccination strategy, and we take that advice from our public health officials as to who should get vaccinated in what order. And clearly the priority at this stage is to reduce the case numbers and the virus in those areas of concern, which is why we've been targeting the 16 to 39-year-olds in those areas of concern. And can I please stress, newsouthwales.gov.au, you can get a jab as early as tomorrow or the day after if you book today. And it's really, really important to get as many people in those age groups as possible in those areas of concern vaccinated. I'm pleased to say that I understand more than 300,000 people in that age group have already booked and are starting to receive their vaccines. That's on top of the 100,000 authorised workers that we already had in place. And we're using opportunities, especially over the weekend, to target specific occupations, and we'll have more to say about that in coming days to make sure that all categories of frontline workers, everybody who has contact with others, comes forward and gets vaccinated. And obviously our strategy also has included making sure that categories of workers who want to get back to work are vaccinated to keep everybody safe.
Premier, Aboriginal communities say that you've been negligent by letting the virus spread in really vulnerable remote communities. Is that fair?
Well, the New South Wales government has worked really hard to support all of our vulnerable communities across the state, and will continue to do that. And again, our certain vulnerable communities were earmarked to be vaccinated by the Commonwealth many months ago, and we're addressing those issues now. We're stepping up as a state and supporting the Commonwealth in those vaccination programs, and thank you to the Commonwealth for getting us vaccines to those areas of concern. But we want to make sure that everybody has the opportunity to get the vaccine as quickly as possible, especially the most vulnerable. And that is our plea, and our heart goes out to any person who feels vulnerable because they're not vaccinated, and that's why we're saying to everybody, please come forward and get the vaccine. There is supply available, especially for vulnerable communities, but also for anybody who wants to safeguard their family and their loved ones.
Alan Joyce has said today that we're more likely to go overseas than we are domestically. Alan Joyce has said that we're more likely to go overseas than we are domestically. What do you make of that statement, firstly? And do you think that, for instance, WA and Queensland will stick to the National Cabinet Agreement?
Well, I hope that all of our colleagues stick to the National Cabinet Agreement, and I've tried to be as direct and as real about this as possible, but every state, once we get to 80% double dose vaccination, which very few nations, I think there's only one nation we know of that's managed to get to double dose 80%, and I'm confident Australia and New South Wales will because of our attitude and the way in which people have stepped up. But once, if not at 80%, when do you open up? When do you say enough, we have to let ourselves in a managed way? And remember, even at 80% double dose, we'll still have rules in place, we'll still have restrictions in place, but it'll be nothing like what we're living through now. But even at 80%, people will need to make sure they sign in for their QR codes, social distance, good hand hygiene, and depending on things, there'll be various restrictions in place even at 80%. But we'll be living life much more freely than we are. And the reason why you do have restrictions in place even at 80% is to make sure that you're protecting those who are unvaccinated, but also even those who are vaccinated can still, especially if they're vulnerable, can still get the virus. So at 80%, we'll be living life much more freely, but in a managed way. And all states in Australia are going to have to come to terms with this. And there has to come a point in time where leaders say, OK, enough's enough. We now have to accept we can't live like this forever. We have to allow loved ones to come together. We have to allow Australians to move freely within Australia. And that's why it's so important for everybody. It's confronting. Believe me, I know what it's like. It's extremely confronting to have to honestly and directly say to your citizens that there is no easy way through a pandemic. There is no easy way to open up. There is no easy way to expect that, unfortunately, some people will get very ill, especially those that aren't vaccinated. It's a horrible situation to be in, but one which every single citizen of the globe has to come to terms with. And our best way is to do it in as managed way as possible by having high vaccination rates, being very responsible every time we open up, every time we make a decision, and making sure the community feels at all time that their safety and health is our first priority.
This announcement today how they can safely open up in future. Is hospitality one of those industries, and how do you plan on trialling that?
Look, every single industry will have the opportunity to work with government to open up safely, and I want to be very clear about that. We're not going to, and that is one of the reasons why we wanted to do all the industries together, to say that every industry has the opportunity in a COVID-safe way, with the restrictions that we'll have in place at the time, to offer vaccinated citizens opportunities to use their services. And I want to be very clear about that. At 70% double dose, it will be vaccinated people that will have those extra freedoms. Well, we will have, I do not want to provide any details at this stage, because we're working with industry, we're working on our roadmap, we're working within the National Cabinet settings as well. So I just want to be very clear that as soon as the New South Wales Government has confirmed which industries will be able to open up to some extent from the 70% double dose in a safe way, we'll of course let the community know. But I do want every industry to be ready.
And that's where we farewell viewers on the main ABC channel in WA. If you want to continue watching this, you can do so on the ABC News channel.
Population is vaccinated, and we're looking forward to starting and continuing some of those discussions that have started. But central to that will be vaccination, but also our capacity to make sure QR codes, proof of vaccination, a number of other settings are in place to make it as safe as possible, because during every step of the way, even when we're at 80% or higher rates of vaccination, we need to keep an eye on keeping people out of hospital and managing that well. And that's why at every milestone that we hit, we will experience much freer life for those of us that are vaccinated. But at the same time, whilst COVID is with us, we have to assume that there'll be certain things we'll always have to manage with COVID. But it doesn't mean life will feel like what it is now. Quite the opposite. Life will feel much freer, but we'll do it in a very safe way. But also people will also assess their own personal responsibility and their own risks. For people who are feeling vulnerable, will choose what activity they participate in. But the opportunities will be there, and we're asking industry, which they have been, to continue to work with us on having safe ways we start opening up at 70% double dose. One last
Deputy
question.
Premier, you said
last questions, yeah.
Deputy Premier, you said you wanted to give regional
Sorry.
You said you wanted to give regional New South Wales certainty in a long-term plan. This is a 2-week plan. Obviously, in 2 weeks, we could still likely have 1,000 cases. It could still be a tinderbox ready to explode, as you say. Has any hope for towns without cases to get out of lockdown? Does any of that hope still remain?
Of course there's hope. I mean, again, for the regions, the lockdown, the restrictions that are in place are to protect regions. I don't want cases. I don't want sewage surveillance to say there are fragments that have been detected that are putting a community at risk. You know, you all have raised the issue about our health system in regional rural New South Wales, and the other part of this is making sure we don't overwhelm our health system. We need to give the health system a bit of a break as we are dealing with significant pressures here in Sydney. So we have an opportunity to play our part. A 2-week extension gives us ability to grab more data, to understand exactly what's occurring in the regions, and it is a tinderbox, because if you have a look at what's happening in Western New South Wales in places like Dubbo, the reach is significant. The interconnectivity between regional communities is part of who we are and what we do. And I know there are areas that have never had a case, but you know, there's never been a case of the Riverina in this outbreak, but we've got fragments now in Temora, or exposure sites, in Temora. We've got fragments in Cooma, we've got fragments in Merimbula. Tamworth, which was previously clean for 2 weeks, 2 to 3 weeks, is now under sewage surveillance, has got some issues. So for me, this is the right decision to inform the community that a 2-week extension is appropriate, and it's the balanced approach by the government. And we'll deal with that, we'll assess that. If it means further extension, we'll make that decision early. If it means an opportunity for regional areas to open, we'll make that decision, but we'll base that on the advice and the data that's in front of us.
Can you run us through the changes, quick fire, run us through the changes to the public health orders in terms of funerals, etc., and then also when will the permit system be coming online for people who will have to have one on Saturday?
For what? Sorry, Liz, that's what you said.
The permit system. Well, one, the funeral question. Yeah, two questions.
So you've changed the rules. So you've changed the rules for funerals. Can you just outline?
No, the funerals are still at the same position, 10 people for the funerals.
So it's not changing in the local government areas of concern?
No, there's no changes there at the moment. So they're staying the same as they were. Can I just emphasise this? Someone asked earlier about vaccinations. Can I just say, we've heard Dr Skinner and others today talking about the fact that they need our help. Can I just say, the gift that we can all give our doctors and nurses who look after our lives and keep us safe is to go and get vaccinated. I've just received a text message saying that we still have vacancies today. We have 8,000 at the Kudos Stadium, we have 2,500 at Macquarie Fields, and we have 1,000 at Prairie Wood. So there is no excuse. Today is a wonderful sunny day. Get online to nsw.gov.au and make sure that you get out and get vaccinated today. Can I also add one final thing, and that is that I have just signed orders this morning which ensure that the medical staff in our hospitals will be required to get vaccinated, and of course also signed the orders that the federal government have asked to be signed in regard to aged care. So again, it will be mandatory for staff, except with medical conditions and related matters, to actually get vaccinated. And I just ask all of our staff who haven't yet been vaccinated, the majority have, please get out and take an opportunity to get vaccinated as well, because it's absolutely critical that each one of the health staff look after themselves. As Dr Skinner said, they're all obviously exposed to the challenges in that regard, and looking after patients, and the safest thing you can do is to get vaccinated.
Just on permits, the permit system.
I'll come back to you.
The permit system.